So, as I promised, something much less traumatic, potentially, than last time. We're going to be discussing second opinions from doctors. Before we do that, I'm going to say hello you. I'm Leah, and I have a particular interest in this subject because I did get a second opinion, and I was surprised at how many people I have come across, both online and in real life, that wanted a second opinion but didn't seek one out. And I wondered whether some of that is to do with culture and some of it is to do with being concerned for some reason at getting a second opinion. So I thought we'd talk about it today. Second opinions are, in Britain at least, they are something that is legally recognised as something that you can do under the 1974 NHS Act. But that refers specifically to hospital services. So in terms of your family doctor, it's less clear. And certainly the only definite thing I could find out was that in England and Wales, certainly, you are legally entitled to go to any GP in the country for the purposes of contraception. But it really mostly relates to hospital care. So what I'm talking about is not the concern that you may have about your family doctor. We'll cover that in another one where I'm going to be talking about your treatment team. But what I am talking about is hospital care. Because let's face it, if you go to buy a new laptop, you're going to look around for prices and specifications. If you need a new bit of plumbing in your flat or your house, you'll get quotes. But something that is as life-altering and potentially life-threatening as cancer, you take the first person's word for it and trot off and think, okay then. That seems quite bizarre to me. But why would you want one anyway? Well, there is the benefit of having another set of eyes on what you've got wrong with you. Now, nowadays, it's not uncommon in cancer to have a diagnosis only when they've done usually a biopsy, but it could be a liquid biopsy or something else that's showing you the exact DNA mutation. So it's a fairly definitive diagnosis nowadays, but not for every cancer. But there's so much more to talk about in your first appointment. There is treatment options, there is things that you can do for yourself that might help your situation with cancer, and the doctor may be advising you on lifestyle changes, dietary changes. They may not. They may just say you're booked in for surgery tomorrow. Because in Britain we have the National Health Service, and in the National Health Service, despite the fact that we all pay for it, there is an attitude of you get what you're given. If you get given something that's fantastic and is perfect for your needs, then great. That's not uncommon. It's not the most usual thing, though. The most usual thing is, here is what we're offering you. You really don't have much of a choice over this because we're the NHS. And as I said before, there is a cardinal rule about if you're a patient, you must be grateful. But I think with cancer, it's worth doing. Now, I wasn't always of that opinion, and then I was sent off to my first appointment with a haematologist, and that man was the worst doctor I think I've ever experienced. I ended up having to have 2 appointments with him, and he was just awful. Now, a lot of things are very personal on what you would find the best type of doctor treating your cancer and the one you wouldn't. You might want someone who's fairly relaxed and informal with you. You may want someone who is quite maybe not even dictatorial, but somebody who's going to be quite firm with you about what it is you're going to receive. It's all very personal. However, this man was odious. He sat back in his chair and didn't seem terribly interested in anything I had to say, really. He turned up for a 2 o'clock appointment. It was 2:10 appointment. He turned up to the department, not even just to see me, but to start his afternoon clinic, which was supposed to start at 2. He turned up at 5:15. I saw him at 5:50, having sat in an outpatient waiting area for him to bother to show up. And according to the staff in that unit, that's not unusual for him. That's just what he does. And seeing him, he was the one, if you've seen other uploads that I've done, then you'll notice that he was the one who said there is only one type of treatment for your cancer. It is a very, very harsh treatment, he kept saying, and that's what you're getting. And I asked him specifically about a treatment that I had read about, and he said, no, that's not even a thing. That doesn't exist. What are you talking about? This is what you're getting. I found him rude. He at first didn't want to refer me to a dermatologist because my leukemia manifests itself in my skin. That was the first place it did manifest itself, and then it spread to my lungs. He didn't want to refer me to a dermatologist. I had no idea why I was going to see one. When I insisted, he then said, they've got a huge wait, can't possibly see you. And I said, I don't care, I'd still like to be referred. I'm so glad I did. My dermatologist is fantastic. She is the polar opposite of this person. I didn't know how to get a second referral, and so I ended up asking at the hospital. In England, we have a system called PALS, and they seem to be quite useless in my opinion. Now, maybe people have had good experiences. Please tell me about them down below. But my experience was they were useless. They were very hard to get hold of, and when you got hold of them, they said that what they would do is email the consultant I was saying I wasn't happy with and basically ask him what to do. Well, eventually the answer came back, I've spoken to everybody in my department and they agree I'm the best person at this. There isn't possibly anybody else who can do this. And I just felt wretched because I thought, I'm stuck with this guy. Now, if you know anything, not just about cancer, but about other serious chronic illnesses, we're not talking about sort of dislocating your shoulder or an ingrowing toenail. You're talking about something that is a long relationship with that doctor. It's not one and done. It's it's a continuing relationship, hopefully for a number of years. And it's not possible to have that relationship with someone who makes you feel so awful and that you fundamentally don't trust. I didn't know what to do about that. And so I phoned my CNS, who deals with my ovarian cancer, so she's a women's cancer specialist, and asked her what to do. And I said, what is the process for a second opinion? Because I didn't know. And she gave me great advice, and as far as my experience goes, was the absolute right advice. And she said, get an appointment with your GP. Your GP can refer you for a second opinion. That's the first thing to do. While you're waiting for your GP appointment, because we all wait for GP appointments nowadays, the best thing to do is go on the web and hunt out the doctors in your area. So for me, that's London, who specialise in your form of cancer. And they will usually have a short 1-paragraph CV where you can have a look, see who looks suitable, who is within reasonable distance of where you live, and ask your GP to refer you to them. So that's exactly what I did. I asked my GP, and I was expecting a bit of a fight on my hands about this. GP was absolutely fine, didn't question it, said, do you know where you'd like to go? And I said, yes, I'd like to go to this consultant at this hospital. And she said, fine, no problem. That was in the evening. The next morning I had a text from my GP practice to confirm that they had sent the referral letter through. Now, it worked out beautifully because I got in front of the right doctor. But I did ask a few people about whether it was always such a straightforward thing, because I was quite reluctant to ask for a second opinion. You wonder whether you'll be labelled as a difficult patient, or there's going to be some black mark on your medical records because you dared to question. But actually it's not. And with certain chronic illnesses, and certainly with cancers, it is very, very common apparently. And so nobody thinks anything of it really. You just are sent by your GP for a second opinion. Now, what I didn't do is to go into a great explanation with my GP about what a interesting person the first doctor had been and what I thought of him, because I didn't think that was going to get me anywhere. Asking just for a second opinion was by far the easiest way to get around the problem. I didn't need to explain to anyone how dreadful I thought this first doctor was. All I needed to say was, I have cancer and I would like a second opinion. Apparently, this is a really normal thing to ask for, and quite common apparently. So if, like me, you're reluctant to ask for a second opinion, or you fear what might happen if you do, it is absolutely worth it, because you are dealing with somebody who will be responsible for, have primary responsibility for your health care for at least a couple of years, maybe longer, depending on your type of cancer and how it's progressed. So it is worth spending a little bit of time and the hassle of a GP appointment. Do some research on Google, find out who the good people are, who you think you might get on with, and might have characteristics that you think are important, like they're very experienced, or they're newly qualified as a consultant, or that you're female, you have breast cancer, you want to see another woman. If those sorts of things are important, then for goodness sake, look up somebody with those sorts of credentials, as well as obviously their medical qualifications. Now, if you have an unusual cancer like mine, it is worth finding out whether they actually do specialise in your type of cancer, because a bit like Gordon Ramsay's advice about restaurants with very long menus, you don't want someone who claims to treat every sort of cancer everywhere, no matter where. You want someone who has some expertise in exactly what you want. And then have a second opinion and go and see this new doctor who will be able to confirm the diagnosis or not, but also can give you their take on treatment options and where you can go from there, and see if you would prefer to be that doctor's patient. You can say so. So it's not that I have no doubts, it's better than that. It's changed the way I viewed my treatment and my care just by having a change of consultant. It's made the world of difference. My consultant is precisely what I need, in my opinion. So please don't feel as though maybe it looks bad, maybe you'll have a big problem with it. It's done routinely in the healthcare setting. And also, you don't have to give a reason. You don't have to go into the why you don't like your doctor. You don't even have to say you don't like them. Just say that you'd like a second opinion. So if you're in that situation, or you have a loved one in that situation, please do go and harass your GP and get yourself a second opinion, because if it's a long-term relationship, it's worth getting something close to what you want. So there you go. I hope that was less traumatic than the last one. Thank you very, very much for your time. We're all a bit time poor nowadays. I really appreciate it, and I hope to see you in the next one. Thank you.